Welcome back to GTU. Strep, flu, the sniffles, and so much more. It's cold and flu season yet again, and the Tanner Clinic compared the illnesses that most commonly affect people during the winter months. ABC4's Janine Golightly has more in today's sponsored segment.
Well, I'm not going to tell you anything surprising today. It is cold and flu season, unfortunately. We get to this time of the year, right? But I'm here today with Dr. Cline. He's a family practitioner or doctor of family medicine. And we just want to talk a little bit about different illnesses that come up this time of year and maybe how people can tell what the difference is, and because there's lots of things that have similar symptoms, right?
Right, there's lots of things that have very non-specific symptoms. So I'm just going to kind of run through a few of those and help our viewers understand how you can distinguish between them.
Okay.
One that people get a lot, of course, it's flu season, starts now and goes all the way till spring. And with the flu, you'll get a rapid onset of symptoms. Some things kind of develop gradually, but the flu is very fast. Some hallmarks are high fever, a headache, and then people will get swollen lymph nodes up and down their neck. And if you come in quickly with the flu, there are some good medications that can shorten the duration considerably, some good antiviral medications. But they're most effective in the first 24 hours and still some good benefit in the first 48, but after that, there's not a lot the medication does. So a good way to get in quickly is with telehealth visits. Yeah, those are very nice for getting in early. So
those are great now. We're actually going to look at a chart that is going to show people, I actually want to have this chart because you don't necessarily know what you're dealing with. Let's go on to some of these other ones, like strep throat is a big one, right?
Yes, strep throat. And this chart, by the way, is from the American Academy of Family Medicine, so it's a very good evidence-based chart. Strep throat, of course, there's the sore throat, and you'll have to get a flashlight, look in the mirror, and see if your tonsils look like they're red, swollen. Do they have white spots on them? If either side of your throat has swollen lymph nodes and they're feeling tender. If you have a fever, and if you're younger in age, the younger a person is, the more likely it is to be strep throat. The older somebody is, the less likely it is.
And that's something you don't want to mess around with. You probably want to call the doctor and come in and see, what maybe there's an antibiotic or something they could take.
Yep, and it shortens the course of the strep throat by about 24 hours, which if you've had strep throat, that's a big deal.
That is a big deal.
And can keep it from going on to become something more serious like an abscess or something like that.
Well, and then of course you got your common cold, you've got some of these other things that maybe aren't as big of a deal or as serious.
So with the common cold, it's typically a low-grade fever, so low hundreds. And it's so non-specific. It's kind of like, I like to look at the other things and say, okay, I don't think it's these things. It's probably the common cold.
Yes.
If your fever gets up to 102, 103, it's a good chance it's something else. And if you're getting chills and just feeling really bad, it's probably something else. But if it's just kind of a scratchy throat and a cough and they're just kind of annoying, then it's more likely to just be the common
And then you
cold.
just tough it out and take your over-the-counter stuff.
That's true. Supportive care treatments, and they can actually be quite helpful, so I don't mean to downplay them. Vitamin C and zinc daily has been shown to improve symptoms and shorten duration. Rest, good hydration, basics like that go a long ways.
Okay.
And then just whatever over-the-counter medications target your specific symptoms to help you be more comfortable as you weather it out.
Okay. Well, and then we didn't really get to touch on bronchitis, sinus infections, some of those things. COVID. I mean, how do people know it's not COVID or?
COVID is one of the most non-specific of all.
Okay.
And fortunately, it's easy to get in a telehealth visit to get a negative test. And the main thing that a COVID test will do is let you know to quarantine. Treatment doesn't change unless you get hospitalized. And the time when most people know it's time to go to the emergency room to get checked out is if they're having shortness of air to the point where they feel like they can't keep their oxygen levels up. In which case you go to the hospital, they get a chest x-ray, they do risk stratifying labs. But otherwise, yeah, it's just same treatment as the common cold at home.
Okay. This is super helpful. I love this, and I love this chart. Thank you so much, Dr. Cline, for spending a few minutes with us, and it'll hopefully help people take a little bit better care of themselves this season. So if you want to get a hold of Dr. Cline, just here at Tanner Clinic, go to tannerclinic.com. And they can reach out to you.
Okay, thanks for visiting us.
You bet.
Thank you, Janine, and thank you for that sponsored content. Up next, we're sharing a few tips to beat that afternoon slump.